Hi, so this video will be talking about a special condition known as short cervix. So short cervix is the condition where the patient has a cervical length of less than 3.5 to 3 cm. So a healthy cervix will have a minimum length of 3.5 to 4.5 cm. So anywhere in this range is considered normal or healthy. So if you have a cervical length of lower than 3.5, you are considered to have a short cervix. So short cervix can be acquired either naturally or through artificial reasons. If you are naturally born with it, it is a congenital short cervix. Now, if you have undergone certain surgeries such as cervical conization, cervical conization is a surgery where they remove part of the cervical tissue because of spread of cancer cells. So because they want to stop the cervical cancer from spreading from the tip of the cervix all the way to the uterus, we need to remove these cancerous cells. So this surgery will remove cervical tissue, causing it to decrease in volume and also in length. So short cervix can cause late miscarriage or a preterm birth because during the late miscarriage, during a late pregnancy, the womb has expanded and also the fetus has grown into a significant size. So both of them have a significant volume and pressure that is exerting on the cervix. So if you have a short cervix during late pregnancy, it will cause premature dilation, which means the inner orifice will open up because of the immense pressure. Due to the short cervix, right, it is unable to withstand the immense pressure, leading to a late miscarriage or a preterm birth. Now, to avoid this, you need to get diagnosed before getting pregnant. Diagnosis for short cervix is very straightforward. We will use an ultrasound B scan to take a look at your cervix. If your cervix is less than 3.5 cm, then you have a short cervix and you need to go for treatment. So if you're unsure whether or not you have a short cervix or not, just go for a checkup with your gynae and have him do an ultrasound for you. Treatment for short cervix is by using 2 cervical Antai rings, placing them on the inner orifice of the cervix instead of the outer, using 3D laparoscopy. So by placing the first ring on the inner orifice, the second ring has to be placed at least 2 cm minimum above the first ring. Now this will effectively lengthen the cervix, giving it a minimum of 4 centimeters. A minimum of 4 centimeters is required for a healthy and successful pregnancy and labor. An important reminder is that our surgery here for the cervical ring does not require any stitching. So during labor, when the rings are removed, there will be no bleeding at all. So there wouldn't be any other further pregnancy complications.